Now to the pandemic dominating the campaign and prompting new warnings from health officials. Deaths in the U.S. hitting 230,556. And according to an internal memo from the Department of Health and Human Services obtained by ABC News, cases are on an upward trajectory in just about the entire country. ABC's Trevor Ault reports from New York City.
This morning, as states repeatedly shatter coronavirus records, officials continue to sound the alarm.
This disease is unrelenting. It doesn't care about what the location is.
According to an internal HHS memo obtained by ABC News, 48 states, all except Nebraska and Delaware, are seeing cases rise, and deaths are climbing in 29 states.
This is an incredibly dangerous virus.
Kathy James says she and her son-in-law, Doug, were ridiculed for wearing masks in South Dakota. After Doug got sick and lost his fight with the virus, she had to break the news to his wife, her daughter, Katrina.
To tell her that he wasn't going to make it. It's just not something that you want to have to tell anyone ever.
New York will now require out-of-state travelers to get a negative test before they visit, as this weekend NYC officials broke up this illegal Halloween party packed with nearly 400 people. In El Paso, FEMA setting up a field hospital to treat the deluge of patients in the same tents previously used to house separated migrant children at the border.
Whenever FEMA comes into any community, it's not a good thing. It means that the resources have been strained to the breaking point.
The virus still taking an unimaginable toll. Kentucky Sergeant Michael Keene, a veteran with no pre-existing conditions, died from COVID just days after his son was born premature, the baby now in critical condition. Mother and wife Nicole left picking up the pieces.
He was my world. He was my everything. Our entire life has changed in just a matter of a couple of weeks, and nothing for us will ever be the same.
And health officials continue to say small gatherings with friends and family are a major source of viral spread. Dr. Deborah Birx would not go as far as to say people should avoid getting together for Thanksgiving, but she says it's incredibly important everyone stays apart for the next several weeks. Eva?
Something everyone's watching as we head into the holidays. Trevor Ault for us, thank you. Let's bring in Dr. Ashish Jha, Dean of the Brown University School of Public Health. Thanks so much for being with us this morning.
Good morning. Thank you for having me on.
So let's start. I'm curious, what's your reaction to Dr. Fauci's comment to the Washington Post that, quote, we're in for a whole lot of hurt in fall and winter?
Yeah, what Dr. Fauci is voicing is what all of us have been worried about. The experts around the country, but also the HHS memo that you referenced, that over the next 6 to 12 weeks, we're going to see a surge in infections. Hospitalizations, which are already rising, are going to continue to rise. And we're going to see a lot of Americans dying from this disease. It was all preventable, but that's where we are right now, unfortunately.
We're also seeing doctors reporting some patients who have both COVID-19 and the flu. What kind of a challenge is that for doctors treating those patients and for those patients as they try to recover from both the flu and COVID-19?
Yeah, luckily that's pretty uncommon, and I suspect it'll remain uncommon. Obviously, anything is possible, but obviously getting two infections at once can be that much worse. We just don't have much experience with managing people like that, so we're going to have to take this very carefully.
And let's talk about the experience and the capacity. Hospitals really starting to feel overwhelmed by this. How do hospitals prepare for this type of influx of patients?
Yeah. So I think hospitals across the country are starting to prepare. I'm talking to hospital executives across the country. People are working on expanding capacity. You know, in New York, during the spring, we had doctors and nurses fly in from across the nation to help. That won't be happening because the surge is happening everywhere now. So hospitals really have to think about their own local capacity and work on that.
And something we will all be watching and monitoring as we head into this winter. Dr. Jha, thank you so much for your time.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.